Welcome to NYC Health and Hospitals Kings County YouTube podcast. Today we are here with Dr. Mel Stone. He's our chief of surgery at the hospital, and this is 25 questions with Dr. Stone. You ready?
I'm ready.
Number one, what do you love most about your job?
I love the clinical aspect of it because I still get for the most part, I still get the same satisfaction, and joy out of just really helping people with the skills that I've learned.
Number two, where are you from?
I'm from Chicago.
Number three, who were your childhood idols?
I've had a lot, but to be quite honest with you, when I think about it, probably I'm a mama's boy, and not in a traditional sense, because I am sitting here because of my mother, who, may she rest in peace, probably would have made 10 times the doc I am. She was always super excited about medicine, even when I didn't even know I wanted to go into it. She was the driving force of pretty much most of my accomplishments, so she's probably the number one idol.
Number four, what are your hobbies?
I probably dabble in a lot of stuff, not good at any of it. But back before 2 surgeries in the last few years, pandemic, I was kind of like a weekend triathlete guy and running, those kind of events, stuff that small athletes can do. Dabble in music, not enough to get paid. That's why I'm here. Like to read still, stuff that has nothing to do with medicine. Kind of think of myself as sort of a history buff, nerd that way, science stuff. I'm a nerd. Nerds rule in the end.
Number five, what did you want to be when you were a kid?
Wanted to be an astronaut. Told you I was a nerd. So then it turned into being an engineer. And somehow I ended up getting into surgery. It was a lot of stuff. There was even like a puppeteer in there at one point. Don't even ask. But my nephew is into puppets right now. Around the same age, I wanted to be a puppeteer, but I don't know what his excuse is because we got all this electronic stuff. But
Number six, what was your favorite class in school?
That changed with school, but probably early on was history and English, and then it became math. It became all about math. Interestingly enough, it really wasn't science until later, if you can distinguish those. But, I was helping my daughter with some math the other day, and I miss it. I miss the certainty of it. Yeah.
Number seven, who was your favorite teacher in school?
Miss Klutz.
Why?
Because she didn't tolerate any, she brought all your best teachers bring out the best in you. You don't realize it as a kid, but when you look back, you're lucky you had a Miss Klutz. And to this day, when I'm looking over notes that the residents may write, or I'm writing a paper or something, I think about what Miss Klutz would have said, where the noun should be, the subject, the verb, all that stupid stuff that she taught me. I doubt she's alive still, but Miss Klutz didn't tolerate anything but excellence. She was great.
Number 8. What is your all-time favorite song?
Man, that's hard. Nobody got one song. You would have to break it down by genre. But if I had to pick a song, I probably would pick something blues circa Muddy Waters of the Howlin' Wolf, because you can really trace American music back to black music. All of it is black music. And you can trace that back to Africa. It's all African music. So if I had to listen to something for the rest of my life, probably be Smokestack Lightning by Chester Burnett, Howlin' Wolf, because it's a gangster ass song. Oh, can I say that?
Number 9. What is your all-time favorite movie?
I'm gonna say something stupid. I guess I could watch Godfather 1 and 2 any day of the week. I could watch it right now and still find something new in it. But at the same time, I've probably seen Predator 80 times. If you guys are old enough to remember Predator, Arnold Schwarzenegger should have got an Academy Award for that. That shows you where my movie sense is. Yeah.
Number 10, what type of cosmetic surgery do we have available?
Well, we are beginning to at least in the Department of Surgery, we do some things that may be considered cosmetic as reconstruct. For instance, I had mentioned that we do breast recon for women suffering from breast disease, and that's not considered cosmetic, but there is a cosmetic component to that, to be completely frank. We are just now beginning to get reimbursement, have a reimbursement schedule for some of your common types of cosmetic surgery. But I'm a little reluctant to expound on that a bit because we're just beginning to do that. So there are some earlobe things, some nose things that we're doing. We have within our bariatrics program, there's an offshoot of what we call body contour. So when people lose a lot of weight, sometimes they have a lot of extra skin, and so we do what some people commonly call tummy tucks, and lifts and arms and thighs where we may make those smaller because there's a lot of loose skin. And some of the more traditional things, we may do some breast augmentation, but in breast reduction. As many women may find a lot of issues with having large breasts in terms of orthopedic issues, back problems, and so forth. And so I'll stop there, but it's on the horizon that we'll be doing more of the stuff that more common folk think of as, other types of augmentation. Does that answer your question?
It does.
All
And
right.
that leads me into number 11. How can plastic surgery be dangerous?
Well, plastic surgery is the operative word. There's no pun intended. Surgery and surgery, whether small or major, can always have complications, which is therein lies the danger. A perfect example, and which feeds back to the first question you asked me. We have a lot of women who desire to get cosmetic surgery. Things they might want smaller waist, larger breasts, more defined buttock areas. You may have heard of the Brazilian butt lift that everybody's talked about. Well, those surgeries tend to not to be either super expensive here in the States or are not offered at facilities like our own, where we're a city hospital where our first mission is to treat more traditional diseases for those who can, for anyone who comes through our doors. But back to the danger part, many of these women in our very own community will go what people have talked about, tourism medicine. They'll go to Latin America, the Caribbean, where they can get many of these types of surgeries for a lot cheaper than here in the States or down in Florida as well. And what happens is, especially outside the country, I don't want to comment on any surgeons in a pejorative sense, but we talked about accreditations and all these standards of qualities. It's not clear what those are when you're going to a different country. And I've had many women come back on a regular basis to our ED because they have complications of the surgery that they had overseas or down south in Florida. So that I really think because this our community is going to seek out plastic surgery regardless of what our own personal opinions might be. I think it is incumbent upon us as an institution that is committed to serving our own community that we may want to consider doing some of that very surgery here where they don't feel a need to go elsewhere, where we can provide quality care and quality standards that live up to what we think should be and hopefully have better outcomes. And I do say women, but that's probably unfair because men do get cosmetic surgery too, and I believe there is a statistic out there where men actually get more cosmetic surgery than women. So I just want to be clear on that. This is not just women. But I've seen some very horrific infections and maybe wound complications of surgeries that were done either overseas or down south in Florida, where their patients are sent back here to Brooklyn, or in the Bronx, where I previously was at another sister hospital, Jacoby, where they weren't followed by their surgeon who did the primary procedure. That may be a lot more than you wanted, but I think it's important to get that out.
For sure. Number 12. What is your favorite vacation destination?
Well, last week it was any place but Brooklyn, because it'd probably be my basement, the one in front of a color TV. I'm kind of a sort of a beach guy, Caribbean islands, the DR. I've done actually quite a bit of traveling when I was younger, but I like the beach. When I travel, I'm not really trying to go to museums and so forth. I'm trying to chill on a beach and have a beer, go swimming, go diving or something.
Number 13. What is your favorite restaurant?
You got me, because I'm not as hip as I think I was or am. I live in Harlem, and I tend to stay local, just to keep money in the community. So my son Grill is my favorite place. It's just a French bistro. I think they make the best French fries in Manhattan. All the swankier places, I couldn't name them. I know a place I really like. You should check out this place, Don Korean barbecue. Don, what's his name? Oh man, I love this place. But that, I can't remember the name, so I'm probably not doing good advertising. But I like Korean food, so I like to go down to Koreatown, and there's a wine, a Korean barbecue place there that I just can't remember the name. I love that place. I've been there 3 times in a row in the last 6 months, so that probably would be my favorite restaurant right now. So.
Number 14. What is your favorite TV show right now?
I ain't gonna pretend like I don't watch TV, because I do. What am I? Now it's not like when I was a kid and they had only a few channels. It's like I was in Ozarks, but I'm looking at Better Call Saul right now. You name it. I've been watching TV since I was a kid, and I'm not gonna stop till they throw dirt on me.
Number 15. If you could choose any superpower, what would it be?
I've always been partial to the guys who don't have like these great super, like Superman. He's too super. It's just it's too unbelievable. I've always liked guys like who have issues. Like they're not that, like Spider-Man or Batman or Daredevil. They could get their ass kicked. They're not all omnipotent. So probably agility and jumping off buildings and stuff. I take that because as you get older, you can't move around that much. So I figure those guys are probably not going to have back pain and stuff. So I guess that's not really a superpower. I guess it would be Wolverine, because he can heal. That's a great superpower. Yeah, I'm sure he doesn't have back pain all the time. On the other hand, he can't get drunk. So there's a downside to everything. So, I don't know.
Number 16. What or who inspires you?
Well, again, like I said, I'm a mama's boy. My mom still inspires me from the other side. Oftentimes I'll think of what would mom say, and it's usually the opposite of what I'm scared to do. And that probably is why I'm in this job now. My wife, if she's listening to this next time I'm in an argument, she is an inspiration in a way that she doesn't realize, because she's a lot smarter than me. She never went to medical school. She's a respiratory therapist, but she would have made, again, 10 times the doctor I am. She's a much better clinician. She's just smarter than me. And so that inspires me.
Good answer. Yeah. Number 17. What is your idea of a perfect day?
Perfect day?
Mm-hmm.
Get up in the morning, maybe a run or a swim, get a workout in. If I could, come into the hospital late, do a great surgery where under 2 hours, because I don't like doing surgery a long time, and the patient did well, and then I have no paperwork, and no one calls the chief of surgery because somebody got mad at them about something or had poor behavior, and then I come home and jam, and watch one of them TV shows, and have some top shelf scotch. That would be a perfect day. Yeah.
All right. Number 18, do you play any instruments?
Yeah, of course. So I play guitar. Not a huge deal because a lot of people play guitar. And that's what I do.
What is your favorite childhood memory?
I would say, so I'm lucky. I think I had a decent childhood. Probably just being a kid and just not being at that age where you're 10 or 11 and it's right before you lose that innocence and you don't have real worries. Probably, I can't really specify what a memory was, but I could just remember a time where the biggest worry is like I hate the Stevie Wonder song. I came in, what was I going to get for Christmas? That was my biggest worry. That's not a real worry. Yeah, so boredom. I'm never bored. So childhood I remember being bored when I was a kid. Now, I tell my son, like, you're going to want to be bored one day. So it wasn't a fun memory back then, but now it's like, oh, I love to be bored. Nothing to do.
And next question, what is your self-care routine?
Probably, I'm very active. I probably exercise or do something every day. I'm not great with the diet. I got to get on that. But I think staying active daily, whether that's a morning workout or sneak into the gym upstairs to get on the treadmill for a little bit, midday, or that's probably the healthiest thing I do because I don't sleep well. My diet is not great. That's probably the best thing.
How does someone become the chief of surgery?
Like I was telling you before, I don't know that there is any one path. I will tell you that surgeons that I've looked up to, that I respect, and who are my heroes, is excellence. And I remember Claude Organ, who was the first African-American president of the American College of Surgeons, who I didn't mention him as a hero because that wouldn't be fair, but he is a hero and an inspiration. But he said to me when I was rotating at one of the places he was chief for a while, he said, because I think I was saying that things were too competitive, and he said there's always room for people who are excellent, and that stayed with me. So if you're good at what you do, there'll be chief of surgery jobs available for you. And I just don't mean being excellent at surgery. There's a lot of great technicians out there, much better than I, as there are better guitar players. But I think it's the whole package, how you treat patients, how you treat the people that help you do the surgery. It's just not the surgeon. It's a lot of people doing as anesthesia. There's the nurse. There's the medical student that you're asking to hold the retractor. So it's not just the surgeon. It really bugs me when people think that it's just the surgeon. So it's how you treat the people who are helping you do excellent work. How you treat your Miss Klutzes that kick you in the butt when you needed a kick in the butt. That is that whole package. And I think if you do that, the chief of surgery jobs will line up. And I'm not saying that's what I did. I'm just saying that if you want to ask my advice, I think that's the best way to it.
What was your first job?
My first job was actually one of my favorite jobs. I sold hot dogs and popcorn at Lincoln Park Zoo and on the beach at Oak Street Beach, if anybody knows Chicago, Gold Coast. And I made $3.35 an hour, and I was 13 because my mom said, you ain't going to sit around all summer, you're going to get a job. And I'm like, really? So that's what I did. I loved that job. And it probably was my second favorite job other than like what I'm doing now. I got to be honest with you.
What's your favorite book?
Man, you had to. It's like the movies and the TV. You got to break it down by genre. But in terms of maybe historical fiction, I like there was the what was that one? There's a book, and I'm bad with titles. It's people of other sons. Let me describe the book. The book is about the black migration from the South to the North and the West, and it's really fascinating to me because if you look at black culture in America, black people are not monolithic, as no one ethnic group is. You know, if you go to New York, you see a lot of black people who are from the Carolinas and Florida. You go to Chicago, where I'm from, people are from Mississippi, Louisiana. They talk different. Same thing with California, mostly Texas, Louisiana. But this book talks about how this it's sort of a fictional book, historical fiction, and it talks about how that affected our culture in America, and it is the story of most black people in America, especially in Chicago. It is my own personal story. My grandmother came up from Mississippi, and it's the story of Howlin' Wolf and Muddy Waters, all them blues guys I like. They came up from Mississippi to Chicago to find better work, and story of rock and roll, man, story of hip hop. It is that. And if other history books, I'm a big even though he probably was a pseudo-racist, Churchill, the whole World War II thing. I could go on. I like reading. I can't remember titles, but I like reading. Reading something right now called "We Were the Lucky Ones." Is about this woman who, when she was 15, she found out she was part Jewish, so she had never known this, and then she started looking through her family history, and I think it's a sort of pseudo-fictional account of her family who was Polish and how their sort of diaspora, how they went out. Some went to Russia, some died in the concentration camps, one guy went to Brazil, and it's just a really interesting book. I mean, I love all that history stuff. Yeah.
How do you like spending your birthday?
My birthday's day after Christmas, so it's Jesus Christ is kind of a hard act to follow, so it's usually pretty anticlimactic. But I make sure that I don't come to work if I can get the day off. I take the day off, and I try to eat really nasty, unhealthy foods, and I like to have some top shelf scotch. I'm really kind of easygoing about my birthday because, as they pile up, you don't really kind of want to remember what number you are, so kind of easygoing about it.
And last but not least, what is your greatest achievement?
I don't want to say something corny like my kids or something like that because they have their own stories to which are unwritten. It doesn't take much to make a kid. It takes much to raise a kid, so I'll let you know on that down the road. That's really hard. But in terms of personal achievement, physical achievement, probably PR marathon when I was 25. Will never run that fast again, ever again. Just physically can't do it. And in terms of overall, just just education. I'm real big in education. Yeah, you'd think I'd say something like surgery or something like that, but I think that feeds from the education and training that I had. Been very fortunate to have people who have educated and trained me or pushed me when I had my own doubts. So it's not really achievement, but just good fortune. I guess that's my greatest good fortune, to be afforded an opportunity where so many other people who are probably more talented and smarter than me have not. And so getting all that education and training allowed me to get this chief of surgery job. And even the chief of surgery job, this was all mentors I have around the NYC Health Hospitals, encouragement from others, from my wife and from my mom, from the grave or other side or wherever we go. So this is not so. I don't see this so much as an achievement, but more of just having the good fortune to be in the right place at the right time, with the achievement or accumulation of education and skill set that other people have given me, right? I mean, I worked hard for it, but still, a lot of it is what the opportunities afford you. Mm-hmm. Does that answer your question?
Perfect.
Probably too much of some of them answers, but so what?
This has been 25 Questions with Dr. Mel Stone, our Chief of Surgery at NYC Health and Hospitals, Kings County.